is getting used to long, dark, and rainy days through the winter like we've got right now. For some of us, if you are bummed out by all this, you're not alone. This is called Seasonal Affective Disorder, or SAD, and it is a real thing. Here with some advice to get us through the next few months is Rene Czerwinski from Pacific Medical Centers. Thank you for being here. Like I said, SAD is real. Lots of us are dealing with it, trying to figure out how to cope. So why do some people experience seasonal affective disorder and others don't?
Some people experience it if there is a family history of depression, both major or bipolar. They're at a higher risk for seasonal affective disorder. Women are at a higher risk than men, and then in their 20s, people are also at a higher risk, and then as we get older. And there is no real known reason why one person may have it and not another.
What are some of the obvious symptoms?
It's going to be low mood, kind of fatigue, irritability. The biggest difference with SAD versus depression is that for SAD, it's going to be more of a weight gain and kind of cravings for other kinds of foods, and a general very kind of irritability and no motivation, energy depletes. And
Why does it make you hungry?
maybe we need to bulk up or something for the winter times, and yeah.
Oh, kind of like hibernation.
Kind of like hibernation, I think, maybe, yeah.
So what are some of the options to combat it?
Well, there are good options out there. Psychotherapy is always one, cognitive behavioral therapy, to talk about what's going on, and all that has a high success rate. But there's also things like light therapy, which is kind of a phototherapy. I laugh about it, but I have a happy light, and it sits on my desk at work, and I have no windows in my office, so I use it on a regular basis. But at this time of the year, I make sure I turn it on first thing in the morning when I get there, and leave it on for a good half hour, and then maybe once later in the day if I can't get outside. Other options always include things, normal kind of things for depression. So really good exercise, sleep routines, and even getting outside for 5 or 10 minutes during the day when the sun is out, and getting some of that sun can be really helpful. There is some research done on if vitamin D helps or not. There's no clear results on if it actually works or not, but it can be helpful. And vitamin D levels are typically low in grayer areas, and now at a grayer time. So
you definitely hear about it a lot here. Will SAD go away once we start to get into spring and the sun naturally comes out?
It does. It does. It generally just kind of disappears, and people's mood comes up. They feel better because they're outside, it's warmer, whatever they're doing. And if somebody does have it and they kind of have a history of it, it is something, when we recognize it, that we can go before the season starts and get somebody started on treatment ahead of time, so that they are kind of ready for it, rather than tanking and then having to get picked back up.
Being proactive. I love the options. I'm going to try that happy light. I've got one at home and haven't used it. All right, Rene, appreciate it.
Thank you.
If you would like to learn more about our healthy living segments, or find out more about SAD, seasonal affective disorder, just go to our website, q13fox.com/healthyliving.